One of the most common infections or illnesses in a senior citizen is a urinary tract infection. In fact, they are the second most common infection or illness that an older adult can get, the first one being a respiratory type of an illness like pneumonia. But urinary tract infections are sadly very common, and they're more common in somebody who's in either a long-term care facility or like a memory care facility or a nursing home type of a setting. So I'm here today to help you understand the signs and symptoms that you should be watching for in yourself or in an elderly loved one to see whether it might be a urinary tract infection, and some ways that you can help to prevent it and what you can do about one. Hi, it's Robin with SeniorSafetyAdvice.com. Tune into our channel for tips and hints for seniors and caregivers about aging in place safely. So what is a urinary tract infection? Well, when you have bacteria that is in the urinary system, which is the bladder, the urethra, and the kidneys, and that bacteria doesn't get flushed out like it normally does and stays behind or attaches to the walls of the urinary tract, then that can turn into a urinary tract infection. Keep in mind, bacteria is always present in the urinary tract system or the renal system. But the thing is generally our bodies take care of flushing it out and it's not a problem. However, in seniors, there can be a lot of contributing factors that can keep the body from flushing that out, and that's what creates the infection. And an undiagnosed urinary tract infection, or UTI, it's not healthy, obviously, for the senior, but in some cases, if it goes for a long period of time without being treated, it can be even deadly. So it's very important to recognize it so that the elder can get appropriate treatment as soon as possible. So why do seniors get urinary tract infections more than the rest of the population? Well, it has a lot to do with how bodies change when they age. So as we get older, we have an increased risk, if you're a woman, of vaginal prolapse, if you're a man, of having an enlarged prostate. Both of those can keep you from expelling all of the urine that you would normally. We have changes in our immune system. Things like kidney stones can have or cause problems, can cause UTIs. My aunt had a problem with an enlarged spleen, I remember, and she had urinary tract infections and bladder infections all the time because it impeded the outflow of the urine. Things like malnutrition can contribute to a UTI, as can something like a poorly managed, if you have diabetes and you're not managing it correctly. If you're someone who has had a lot of urinary tract infections during your lifetime, that can contribute to you getting more of them in your older years. Physical changes like a prolapsed bladder, like I was talking about with my aunt and her spleen, those types of changes can create issues that lead to UTIs. Another thing that happens in seniors is that you just end up with weaker muscles all around. And those weaker muscles, especially in the pelvic floor, can keep you from expelling all the urine that you should when you do pass urine. So again, having that bacteria left over in the bladder, the kidneys, and the ureters, that is what turns into a UTI. And the last thing that can affect and cause more UTIs is somebody who has something like Parkinson's or Alzheimer's, just because they may not physically be able to take care of themselves and keep things as clean as they should because of their limitations. And that can be a challenge that creates a UTI as well. So symptoms, the big thing that I wanted to talk about is that UTI symptoms in a young person are totally different than what they can be in an older adult. So if you're somebody who you've had a couple of UTIs in the past, or you have a family member who has, that usually you have abdominal pain, you have burning when you urinate, you might have a fever, but older adults often don't get those symptoms at all. In fact, a lot of times an undiagnosed UTI can actually look like it might be dementia or a cognitive decline in a person. So sometimes it's just written off that the person, they've had something go on and now they've got some cognitive decline and nobody thinks to check them for a UTI. So symptoms to be watching out for that could say that there was a UTI or an undiagnosed urinary tract infection in an older adult can be things like poor motor skills. So if the person had decent motor skills and now all of a sudden they're having trouble picking things up or having trouble walking, maybe they're dizzy, they're lacking coordination, that can be signs of a UTI. Lethargy or just kind of being apathetic, that is another sign. Frequent falls can be a sign of a UTI. Behavior changes can be another sign of a UTI. So can things like disorientation, hallucinations. All these are things to look for that, again, you may pass off as a cognitive decline or the beginnings of dementia, but might really just be something that can be cured with a dose of antibiotics. So the other thing to be sure that you look for in an older adult is dark colored urine, urine that has a strong odor to it, urine that would be pink in color because that means that there's blood in the urine, also urine that's cloudy. And again, we talked about abdominal pain. A lot of seniors that have a UTI don't feel that pain, but they do feel pressure and they do often feel an urge to urinate more frequently. So if suddenly you or your senior loved one is running to the bathroom all the time and they haven't started drinking more fluids, you might suspect that there's a UTI going on. So that brings me to prevention. How would you prevent a UTI? Well, things that can go a long way towards helping keep down the number of urinary tract infections. First, number one is good hygiene. You want to be sure that when you're wiping, if you're a woman, you're wiping from the front to the back. That's something to watch out for, especially in somebody who has dementia or something with fine motor skills like Parkinson's, because they may not be able to accomplish the task in the same way that they used to. And so you want to be sure that they are wiping in the right manner. You also could keep wet wipes in the bathroom and follow up wiping with wet wipes. One thing I will say to you is do not put wet wipes or baby wipes or anything like that into the toilet because it can mess up your plumbing. And that actually goes for wipes that are supposed to be specially for being able to be flushed. Don't trust them. They're too thick. I would tell you to use them and then put them in a basket or bucket or whatever next to the toilet and empty them out periodically because you really don't want to mess your plumbing up with them. A washcloth would be another option to use, keep using washcloths that are moistened so that it just helps to get everything off. Women should not use talcum powder. That's always been kind of something that people used to do. I don't know if they do it so much anymore, but in an older adult who's used to it, you're trying to be fresh and clean and smell good, and you use talcum powder, bad. Don't do that. That can contribute to an infection. Make sure that you or the loved one is drinking at least 6 to 8 glasses of water a day so you're keeping that urinary system flowing and you're not allowing bacteria time to sit in there and get stagnant and start an infection. And a tip for senior loved ones who have dementia or have vision problems, make sure that the glass that you give them to use to drink with is a different colored glass, not a clear glass, but maybe a blue one or a red one, an orange one, something that they can readily see so that they have it right there. It makes it easier for them to think about it and reach for that water and be able to drink more. If the loved one, senior loved one that has a lot of UTIs is wearing disposable undergarments, make sure that they change them frequently. And especially if they do end up having an accident and going in their pants, then they change that as soon as possible so that you're not leaving that bacteria behind to create an infection. And going back to making things easy to see, again, somebody who has dementia or who has vision problems, it's a really good idea to think about somehow highlighting the toilet as far as making it a contrasting color to what they have in the bathroom currently so that they can actually see it. Somebody with vision problems, like my bathroom, has white walls, white tiled floors, and a white toilet. So if I had vision problems, I'm probably not going to find the toilet if I have to go. It just makes it difficult. So consider either changing out the toilet seat to make it a different color that's more easily visible, or somehow, I don't know what you would do, put stickies on it, I don't know what, but think of a way that you can make that toilet stand out so that it's easier for that person to find it. As far as somebody who has recurring UTIs, what I would suggest to you is to speak with their doctor about whether or not they can use cranberry supplements, because those are known to help with UTIs and cutting down the number of them that people get. And D-mannose is another supplement that they may be able to take that can help with preventing UTIs. But again, make sure that you clear all of that with their doctor. Don't just arbitrarily start taking it or giving it to the loved one that is having the UTIs without checking first, just to be sure it's not going to interact with any medications that they're currently on. So those are my tips for recognizing a UTI and helping you to prevent it. I hope that they've helped. If you like the video, please give it a thumbs up, and also don't forget to hit the subscription button down in the corner. Also, if you know someone who could benefit from this video, please be sure to share it with them. Thank you very much for watching, and until the next video, take care. Bye-bye.